Hello, my name is Paul Garcia, and today we're going to be talking about triage. The word triage comes from the French word that means to sort. Triage can be traced back to French battlefields of the 1700s. Triage has been utilized in when we perform triage, it's usually done in a stressful environment. So the steps have to be easy, just like tying your shoes. The triage unit leader must remember that triage is designed to do the most good for the most amount of people. We are going to be using the START Triage system. START stands for Simple Triage and Rapid Treatment. This system has 4 major areas that we check during triage. Those 4 areas include the patient's ability to walk, their respiratory status, their circulatory status, and the patient's ability to follow commands, their mental status. The first step is to have the triage unit leader call out to the victims. If you can hear my voice, come to me. All of those victims that are able to move in that direction are considered to be minimal. If you are using the 4 tarp system, these victims can be directed towards the green tarp for further treatment and evaluation. The next step is to move to the non-walking victims and assess their respirations. If the victim is not breathing, position the airway, and if they begin to breathe, then that victim is considered to be immediate. If you position the airway and the victim does not begin to breathe, then that victim is deceased and can be placed in the expectant category. Now, if the victim's breathing is less than 10 or greater than 30, the victim is considered to be in the immediate category and should be moved to the red tarp when time allows. If we were to find a victim whose respiratory rate was within the 10 to 30 breaths per minute range, then we would move to the next step in the START system. The next step in the START system is assessing the radial pulse. We are assessing the radial pulse to see if they have a weak, irregular, or absent radial pulse. If they do, the victim is classified as immediate and should be moved to the red tarp. If the victim has a good radial pulse, then we'll move to the next step of triage. And the next step of triage includes checking the victim's mental status. Can the victim follow simple commands or can they not follow simple? If the victim cannot follow simple commands, then that victim is considered immediate and should be moved to the red tarp. If the victim can follow simple commands, then that victim is put in the delayed category and should be moved over to the yellow tarp as soon as time permits. Once all patients have been sorted, if we haven't done so already, then they can be moved to the appropriate colored tarps. And our primary triage is now complete. Now that all patients are at the appropriate tarps, they will go through a secondary triage. They will receive medical treatment, and then they will be transported to appropriate facilities. This concludes our presentation on triage, especially START Triage. If you have any questions, please reach out and let me know. Thank you for watching. Have a great day.